Venkatesh Raghuvanshi Valavala. Today I'm going to explain the methodology of the project, the role of technology in bridging healthcare disparities. So, this project is completely based on the healthcare. So, I just want to explain the methodology right now. So, I'll be sharing the screen and you can see the details, and I'll be presenting this PowerPoint. When coming to the introduction, you can see this project. It is the process and method used to design and test a health application aimed at reducing healthcare disparities among unserved groups. It explains how the mobile health and telemedicine platform was developed considering culture and user needs, using user centered design together with agile methodology. Besides, the approach used to assess the ease of use and success of the application with users and data is explained in this chapter. So in this you can see this is the introduction, and let me so when coming to methodology overview, you can see the research problem. Underserved populations face significant healthcare access barriers. Research mixed methods, quantitative and qualitative data integration, and justification blends technology and technical testing with rich user and cultural insights. So when coming to this design and approach, this approach used in the research mixes developing an application through several cycles with examining the impact of the application on users. Both qualitative and quantitative approaches are combined in the research of accomplish the dual goal of creating telemedicine and healthcare that meets culture needs and understands what stops or encourages undeserved population to use their services. So in this development of this application relies on the UCD, encouraging those being served, for example rural patients, healthcare providers and community health volunteers to participate in all stages of design. This way of thinking allows technology to work well for people for the significant specific cultures, languages and locations which are frequently challenging for healthcare technology adoption. When used together, UCD and agile development allows to work in quick sprints that use continuous feedback from users and quick updates. By using a mix of approaches, developers become quick and flexible, improving the chances of developing and valuable digital health tools. So these studies makes us different evaluation techniques to review how easy the application is to use, how users respond to the accesses of their views on how useful and easy a platform is, ask for more insights, culture and respective sessions with the platform to discover any practical difficulties people might face within the approach. It becomes possible to measure both results and acceptance, which help the platform to become the more effective and validates its contribution to reducing differences in healthcare. So when coming to the population and sample, you can see the researchers look at rural patients who are having trouble accessing healthcare, along with community health volunteers and employees at to undeserved health facilities. So, when coming to this research design and approach, you have seen the design approach right now, and you can see type of research mixed method, applied, exploratory and developmental, and sampling. And the purpose of sampling 30 participants contest rural health settings with poor connectivity demanding adaptable design, rational, culturally informed and iterative design for under resourced communities. So the tech stack for coding this application includes React Native for mobile apps, Node.js for supporting backend operations, and MongoDB for organizing health data as it changes. Through AWS Cloud, the scalable infrastructure and data storage are available in RESTful and APIs. APIs make communication easy between the client and server. To give users in remote areas continuous use, data in the system is stored by the client and updated automatically within a stable internet connection in available again. So the system requirements and specifications here. Key functions designed in this into the app are support for different languages, ability to operate within the online connectivity, and built to be reliable, available to anyone and trusted, while meeting the technical and cultural needs of users who are not highly trust served. And when coming to the application development process, as agile methodology dictates, the development is carried out in 2 weeks sprints, so feedback and changes can be added to the product all along the process. The whole process depends on the user, healthcare workers and community members join unstability studies, design workshop and testing, and to help guide decisions. For versioning, I use Git. Jira help sprints to and track issues, and Visual Studio Code is my main development environment. Doing this helps create a digital health product suitable for community and its users. When coming to these security and compliances considerations, to keep the sensitive information, health information safe and away from anyone authorized, the digital health applications add many protection layers. At feed backup, data is protected using AES 256 and TLS during storage and during transfer, which blocks unapproved access. At all stages of the development process, company carry out regular audits and tests uh, to identify and clear out risks. Also, new login methods such as multi-factor authentication and pediatric policy makers prefers that hospital compel with necessary healthcare and privacy standards. Among these, the requiring permission are using data, not collecting more than necessary, and ensuring users can manage their information. The way of working guaranteed the application follows law and ethical rules, uh, earning trust among its users and stakeholders. So, when coming to the testing and validation strategy, uh, the plan calls for the inclusion of 20 to 30 participants drawn from the patients, community, health workers, and healthcare providers, matching the target user population. Testing tasks are carried out by using user to use app as usual, and those participating by pay attention to usability flaws. To measure user experience, we record the completion rate of tasks, time spent on task, the number of errors made, and USS code. So the technical teams use both automated scripts and manual reviews to test the future are working properly on various devices and even when not connected to the internet. At the end of the every development test, to find recently introduced problems, to measure applications usefulness in addressing healthcare disparities, user habits, self report health outcomes, and following chronic illness management process will be analyzed throughout the pilot deployment period. When coming to these uh, deployment and maintenance strategy, the deployment plans involves a phased rollout of the digital health application to the target user population, beginning with the pilot launch in selection rural communities where healthcare access is limited. The initial deployment will include a collaboration with local healthcare providers and community health volunteers to facilitate user onboarding and training. The app will be distributed through accessible channels such as app stores and direct downloads via trusted community networks to maximize reach. So This is the contest rational and research design and approach. So when coming to these data collection app design, you can see design process, inquiry specification, prototyping evaluation, agile 2 week sprint, continuous feedback, and TM based surveys, semi structured interviews using interaction observations, tools React Native, Node.js, and MongoDB. As I explained in the earlier slide, this is the complete design of this project for using these using the tools like React Native, Node.js, and MongoDB. So in this we do have uh, let me show you. Yeah, design data design and analysis strategy, analysis techniques, thematic analysis for interviews, descriptive statistics correction for surveys, SPSS manual coding and usability testing metrics, USS scores, validity and reliability, achieved through data in triangulation, erective testing, and reserve sampling, limitations. So, when coming to these ethical considerations, here we can see the data collection, data analysis, and interception, and interpretation, and refinement. So, the challenges and limitations when coming to this design analysis strategy, several limitations are participated in this study. The sample size for usability testing and survey may be constrained by the accessibility and availability of participants in remote areas, potentially affecting the generalizability of findings. Sorry, limited technology infrastructure such as consistent internet connectivity and low smartphone penetration may restrict both application use and data collection. Varying lead levels of digital literacy among participants could influence adoption rates and user feedback. Challenges in development, including addressing diverse culture and needs within resource constraints and ensuring the applications compatibility across different device types and operating systems. Evaluating the application's impact on healthcare disparities requires longitudinal observation, which may extend beyond the study's time frame. These limitations are acknowledged to contextualize results and guide future research directions. So, this is the design analysis strategy. And when coming to references, these are the references which I used for the methodology for the project. So you can see I used BioPOS, Battle A. These are the authors. I just got these references from these references, and so this is the complete methodology. If I miss something, you can let me know. But this is the I just explained this. I hope I explained this introduction, design and approach, technology, architecture, um, application development process, security and compliance considerations, testing and validation strategy, data collection and analysis, and limitations and challenges. So the complete project of role of technology in bridging healthcare disparities is mainly for the healthcare. It's gonna help many rural people who are having a issue in using this healthcare system. So it's gonna be accessible to everyone. So it is designed for mobile and internet, even with the internet in the system, and phones. Even with the internet and without internet, we do have the access to use this app. It's gonna help many people. So this is the complete methodology terms of this project. Thank you.